In the previous lectures, we studied the normal histology of the lower female genital tract, followed by the uterus and fallopian tube. In this lecture, we will complete the normal histology of the female reproductive tract by studying the ovary. We will begin with the basic microscopic organization of the ovary and learn how to identify its surface epithelium, tunica, albuginea, cortex, medulla, and stroma. We will then follow the complete sequence of follicular development, beginning with the primordial follicle and progressing through the primary, preantral, antral, and mature provulatory follicles. Along the way, we will understand the changes occurring in the oocyte, granulosa cells, zona pellucida, theca interna, and theca externa. We will also study ovulation, the formation of the corpus hemorrhagicum, corpus luteum, and corpus albicans, followed by follicular atresia and the important histological changes that occur with age. Finally, we will summarize the features that help identify each of these structures during practical examinations. So, let us begin with the basic microscopic organization of the ovary. Microscopic organization of the ovary. The ovary is a paired reproductive organ that performs two major functions. It produces the female germ cells, or oocytes, and it acts as an endocrine organ by producing hormones such as estrogen and progesterone. These functions are reflected in its microscopic structure. Under low magnification, the ovary can be divided into two principal regions, an outer cortex and an inner medulla. However, unlike many other organs, the boundary between the cortex and medulla is not always sharply defined. Before studying these two regions, let us first examine the outer surface of the ovary. The ovary is covered by a single layer of cells known as the ovarian surface epithelium. This epithelium is usually simple cuboidal, although the cells may appear flattened in some areas. It is continuous with the mesothelium covering the surrounding peritoneal surfaces and is therefore considered a modified mesothelium. Historically, the ovarian surface epithelium was called the germinal epithelium. This term is misleading because the epithelium does not produce the female germ cells or oocytes. The oocytes originate from primordial germ cells during fetal development. Therefore, the preferred term is ovarian surface epithelium, although the older term germinal epithelium may still be encountered in textbooks and examinations. Immediately beneath the surface, epithelium is a layer of dense connective tissue known as the tunica albuginea. It is composed mainly of collagen fibers and separates the surface epithelium from the underlying ovarian cortex. The tunica albuginea of the ovary is much thinner than the tunica albuginea of the testis. Its thickness may increase with age, particularly after menopause, when the ovary becomes more fibrotic. Beneath the tunica albuginea lies the ovarian cortex. The cortex is the peripheral and functionally active region of the ovary. It contains ovarian follicles at different stages of development, along with corpora lutea, corpora albicantia, and atretic follicles. These structures are embedded within a highly cellular ovarian stroma. The ovarian stroma is composed mainly of closely packed spindle-shaped stromal cells supported by a delicate network of connective tissue fibers. The stromal cells may resemble fibroblasts, but some of them have the ability to differentiate into steroid-producing cells, particularly the cells forming the theca around developing follicles. The cellular appearance of the stroma is an important feature that helps distinguish the ovary from ordinary dense connective tissue. The ovarian follicles are mainly located within the cortex. The smallest primordial follicles are usually found immediately beneath the tunica albuginea, while the larger developing follicles extend deeper into the cortex. However, follicular development is a continuous process, and follicles at several different stages may be visible within the same section of a reproductive age ovary. Moving centrally, we reach the ovarian medulla. The medulla is composed of relatively loose connective tissue containing large blood vessels, lymphatic vessels, and nerves. Unlike the cortex, the medulla normally does not contain developing ovarian follicles. The distinction between the cortex and medulla is based mainly on their contents. The cortex contains follicles and other structures derived from them, while the medulla contains the larger vessels and nerves supplying the ovary. Near the point where the vessels and nerves enter the ovary is the ovarian hilum. The hilum is continuous with the mesovarium, which attaches the ovary to the broad ligament. Specialized cells known as hilar or hilus cells may be found in this region. These are steroid-producing cells that resemble the Leydig cells of the testis. They may contain re-inky crystalloids, although these are not always present. For the purpose of basic histological identification, the most important structures to recognize are the surface epithelium, tunica albuginea, cortex, medulla, and ovarian follicles. Under low magnification, first locate the outer surface of the ovary. Immediately beneath it, identify the thin tunica albuginea. Next, look for the cortex containing follicles at different stages of development. Finally, identify the more central medulla containing large blood vessels and loose connective tissue. A simple way to remember this organization is surface epithelium, followed by tunica albuginea, followed by cortex, and finally the medulla. The cortex contains the follicles. The medulla contains the larger vessels and nerves. This basic organization forms the framework for understanding every other structure that we will study in the ovary. Now that we have understood the general microscopic organization, we can begin studying the most important process occurring within the ovarian cortex, follicular development. Follicular development. The functional unit of the ovary is the ovarian follicle. Each follicle consists of a developing oocyte surrounded by supporting follicular cells. Throughout reproductive life, these follicles undergo a continuous sequence of structural changes, beginning with the smallest primordial follicle and culminating in the mature provulatory, or Graafian, follicle. Understanding these developmental stages is essential because each stage possesses distinct microscopic features that allow accurate identification under the microscope. We will study each stage in sequence. The earliest and most numerous follicles found in the ovary are the primordial follicles. These follicles are located immediately beneath the tunica albuginea within the superficial ovarian cortex and together constitute the ovarian reserve established before birth. Each primordial follicle contains a primary oocyte surrounded by a single layer of flattened follicular cells. The primary oocyte is arrested in the diplotein or dictyate stage of prophase I of meiosis. This arrest begins during fetal life and continues until shortly before ovulation, which means the same primary oocyte may remain in this stage for several decades. An important examination point is that the primordial follicle always contains a primary oocyte. It never contains a secondary oocyte. Histologically, the primordial follicle is recognized by its simple appearance. The follicular cells are flattened, the oocyte is relatively small, and there is no zona pellucida, no theca layer, and no follicular antrum. As follicular growth begins, the primordial follicle develops into a primary follicle. The earliest microscopic change is the transformation of the flattened follicular cells into cuboidal cells. This transition from flattened to cuboidal follicular cells is the first visible sign that follicular development has begun. Initially, only a single layer of cuboidal follicular cells surrounds the oocyte. This stage is known as the unilaminar primary follicle. As development continues, these follicular cells divide repeatedly by mitosis and form several concentric layers around the oocyte. The follicle is now known as the multilaminar primary follicle. Compared with the primordial follicle, both the oocyte and the surrounding follicle increase considerably in size. At this stage, the follicle still does not contain a fluid-filled cavity. As the follicle enlarges further, it develops into the secondary, or preantral, follicle. The follicle continues to increase in size, and the multiple layers of follicular cells become more prominent. Although the supporting connective tissue surrounding the follicle also becomes more organized, the defining feature of the preantral follicle remains the absence of a follicular antrum. Therefore, if no fluid-filled cavity is present, the follicle is identified as a preantral follicle. The next major stage begins with the appearance of the follicular antrum. Small fluid-filled spaces begin to appear between the follicular cells. These small spaces gradually enlarge and fuse together to form a single cavity known as the follicular antrum. The fluid within this cavity is called follicular fluid. The appearance of the antrum marks the transition to the antral, or tertiary, follicle. As the antrum enlarges, the oocyte is displaced toward one side of the follicle. Instead of remaining centrally located, it becomes attached to the follicular wall by a mound of surrounding follicular cells. This arrangement is a characteristic feature of the antral follicle and becomes even more prominent as the follicle continues to mature. Usually, during each ovarian cycle, only one follicle becomes dominant. This dominant follicle continues to enlarge while the remaining developing follicles gradually undergo degeneration. The dominant follicle ultimately becomes the mature provulatory follicle, also known as the Graafian follicle. The Graafian follicle is the largest follicle found within the ovary. It occupies a substantial portion of the ovarian cortex and often produces a visible bulge on the ovarian surface immediately before ovulation. Histologically, the Graafian follicle is characterized by a very large follicular antrum occupying most of the follicle. The oocyte is located eccentrically rather than centrally and remains attached to the follicular wall by a bridge of follicular cells. This eccentric position of the oocyte is one of the easiest features for identifying a mature follicle under low magnification. As the follicle enlarges from the primordial stage to the Graafian stage, several consistent morphological changes occur. the follicle progressively increases in size. The oocyte also enlarges. The surrounding follicular cells increase from a single flattened layer to multiple cellular layers. A follicular antrum develops and gradually expands. Finally, the oocyte shifts from a central position to an eccentric position within the mature follicle. These sequential structural changes provide the basis for identifying every stage of follicular development during practical examinations. It is important to remember that follicular development is a continuous process. Therefore, in the ovary of a reproductive age woman, follicles at several different stages of development are usually present within the same histological section. Recognizing the distinguishing features of each stage allows accurate identification regardless of the size or orientation of the section. Now that we have understood the sequential morphological changes occurring during follicular development, we can examine the specialized cells that make up the follicle and understand how they work together to support oocyte maturation and hormone production. Functional cells and hormonal correlation. Having understood the sequential stages of follicular development, let us now examine the specialized cells that make up the ovarian follicle and understand how they work together to support oocyte maturation and hormone production. Although a follicle appears to be a single structure under the microscope, it is actually composed of several different cell types, each with a distinct function. A clear understanding of these cells is essential because normal follicular development depends on the coordinated interaction between the oocyte, granulosa cells, and the surrounding theca. Let us begin with the granulosa cells. Granulosa cells are the follicular cells that directly surround the oocyte. As the follicle develops, these cells proliferate to form multiple layers around the oocyte and later line the wall of the follicle. They play an essential role in supporting the growth and maturation of the oocyte. Granulosa cells nourish the developing oocyte, regulate its microenvironment, and participate in the synthesis of steroid hormones. Another important function of the granulosa cells is the formation of the zona pellucida. The zona pellucida is a thick acellular layer of glycoproteins that surrounds the oocyte. Histologically, it appears as a distinct eosinophilic ring separating the oocyte from the surrounding granulosa cells. Although it appears to separate these cells, communication between them is maintained through numerous fine cytoplasmic processes that pass across the zona pellucida. These processes form gap junctions with the oocyte. Gap junctions allow the transfer of nutrients, ions, metabolites, and signaling molecules from the granulosa cells to the oocyte. Since the oocyte has limited metabolic activity of its own, it depends heavily on these connections for normal growth and maturation. Outside the granulosa cell layer lies the follicular basement membrane. Beyond this basement membrane, the surrounding ovarian stroma differentiates into two distinct layers known as the theca interna and the theca externa. The theca interna is the inner vascular layer. Its cells are polygonal, richly supplied with blood vessels, and specialized for steroid hormone production. The theca externa forms the outer layer and consists mainly of fibroblasts, collagen fibers, and scattered smooth muscle cells. Unlike the theca interna, the theca externa provides structural support to the developing follicle and does not have a major endocrine function. The relationship between the granulosa cells and the theca interna forms the basis of one of the most important concepts in reproductive physiology, the two-cell, two-gonadotropin theory. According to this concept, estrogen synthesis requires the coordinated activity of two different cell types stimulated by two different pituitary hormones. The theca interna cells possess receptors for luteinizing hormone, or LH. When stimulated by LH, these cells synthesize androgen precursors, mainly androstenedione and testosterone, from cholesterol. However, the theca interna lacks the enzyme aromatase and therefore cannot convert these androgens into estrogens. These androgen precursors diffuse across the basement membrane into the adjacent granulosa cells. Granulosa cells possess receptors for follicle-stimulating hormone, or FSH. Under the influence of FSH, granulosa cells express the enzyme aromatase. Aromatase converts the androgen precursors received from the theca interna into estrogens, principally estradiol. Thus, neither the granulosa cells nor the theca interna can independently produce estrogen. Normal estrogen synthesis requires the coordinated interaction of both cell types under the influence of FSH and LH. This concept is frequently tested in undergraduate and postgraduate examinations and should be clearly understood. As the follicle reaches the antral stage, the granulosa cells become organized into specialized groups. The granulosa cells lining the follicular wall are known as the mural granulosa cells. These cells primarily participate in hormone production. A smaller group of granulosa cells surrounding the oocyte forms the cumulus oophoris. The cumulus oophoris anchors the oocyte to the follicular wall while maintaining close metabolic communication with it. The innermost layer of the cumulus cells immediately surrounding the zona pellucida is called the corona radiata. Unlike most of the granulosa cells that remain within the ovary after ovulation, the corona radiata remains attached to the oocyte when it is released from the follicle. Throughout most of follicular development, the oocyte remains a primary oocyte arrested in the diplotene stage of prophase I of meiosis. Only immediately before ovulation does it complete the first meiotic division to form a secondary oocyte and the first polar body. The secondary oocyte then immediately enters meiosis II and becomes arrested at metaphase II. This is another important examination point. The cell released during ovulation is a secondary oocyte arrested in metaphase II. A true ovum is formed only after fertilization, when meiosis II is completed. Understanding the functions of the granulosa cells, theca interna, theca externa, zona pellucida, and their hormonal interactions explains how the follicle not only supports the developing oocyte, but also functions as a highly specialized endocrine unit. With this foundation, we can now understand the events that occur during ovulation and the remarkable transformation of the ruptured follicle into the corpus luteum. Follicular atresia and age-related changes. Although the ovary contains thousands of follicles, only a very small number will ever reach ovulation. The overwhelming majority of follicles undergo a process of degeneration known as follicular atresia. Follicular atresia is a normal physiological process and can occur at any stage of follicular development, from the primordial follicle to the mature provulatory follicle. In fact, more than 99% of ovarian follicles are eliminated by atresia during a woman's lifetime. The earliest change in an atretic follicle occurs in the granulosa cells. These cells gradually undergo apoptosis and begin to separate from the basement membrane. As degeneration progresses, the granulosa cells become disorganized, their nuclei shrink, and many of the cells eventually disappear. The oocyte also undergoes degeneration and is gradually resorbed. One of the characteristic microscopic features of an atretic follicle is the thickening of the follicular basement membrane. This thickened basement membrane appears as a homogeneous eosinophilic layer known as the glassy membrane. The glassy membrane is an important histological clue that helps identify an atretic follicle under the microscope. While the granulosa cells disappear, the theca interna often persists for a longer period. Some of these thecal cells may remain within the ovarian stroma as steroid-producing interstitial cells. Eventually, the remnants of the follicle are completely replaced by stromal connective tissue. It is important to remember that an atretic follicle does not have a single fixed appearance. Its microscopic features vary depending on the stage of follicular development at which degeneration began. A primordial follicle undergoing atresia appears very different from an antral follicle undergoing atresia. For this reason, the term follicular atresia describes a process rather than a single histological picture. Having understood the normal fate of most follicles, let us now examine how the ovary changes throughout life. The microscopic appearance of the ovary varies considerably with age. During fetal life, the ovary contains numerous oogonia and developing primordial follicles. By birth, all surviving germ cells have already become primary oocytes enclosed within primordial follicles. Throughout childhood, the ovary remains relatively inactive. The cortex is densely packed with primordial follicles, while growing follicles are relatively few because ovulation has not yet begun. With the onset of puberty, the ovary becomes hormonally active. Follicles at multiple stages of development can now be seen within the cortex. Corpora lutea and corpora albicantia begin to appear as evidence of repeated ovulatory cycles. This is the typical microscopic appearance of the reproductive age ovary. As reproductive life progresses, the number of primordial follicles gradually declines because of continuous follicular recruitment and atresia. The ovarian reserve, therefore, decreases steadily with age. Around menopause, most follicles have been depleted. The ovary becomes smaller and firmer. Histologically, the cortex contains very few or no developing follicles. Instead, dense fibrous stroma and numerous corpora albicantia become the dominant features. The tunica albuginea becomes thicker, and the ovarian stroma becomes more prominent. Despite the absence of functional follicles, the postmenopausal ovary is not completely inactive. The stromal cells and hilar cells continue to produce small amounts of androgens, which may be converted into estrogens in peripheral tissues. Recognizing these age-related changes is important because the microscopic appearance of the ovary differs significantly between children, reproductive age women, and postmenopausal women. Understanding these normal variations helps prevent physiological findings from being mistaken for disease. Now that we have completed the normal histology of the ovary, let us summarize the key microscopic features that help identify the ovary and its various structures during practical examinations. Practical identification in summary. Before concluding this lecture, let us summarize the important microscopic features that help identify the ovary during practical examinations. Whenever you receive an unknown histology slide, begin by examining it under low magnification. The first feature to identify is the overall organization of the ovary. Look for an outer cortex and an inner medulla. The cortex is more cellular and contains ovarian follicles or their derivatives, whereas the medulla is composed mainly of loose connective tissue containing large blood vessels, lymphatics, and nerves. Next, identify the ovarian surface. Look for a single layer of simple cuboidal cells forming the ovarian surface epithelium. Immediately beneath this layer is the thin tunica albuginea, composed of dense connective tissue. Remember that the ovarian surface epithelium was previously called the germinal epithelium. However, this older term is misleading because it does not give rise to the female germ cells. The preferred modern term is ovarian surface epithelium. After identifying the cortex, determine the stage of the follicles present within it. If the follicle contains a primary oocyte surrounded by a single layer of flattened follicular cells, it is a primordial follicle. If the follicular cells have become cuboidal but remain arranged in a single layer, it is a unilaminar primary follicle. If multiple layers of granulosa cells are present together with a well-developed zona pellucida but there is no antrum, it is a multilaminar primary follicle. If the theca interna and theca externa have become distinguishable but the follicle still lacks an antrum, it is identified as a secondary or preantral follicle. The appearance of a fluid-filled antrum marks the transition to an antral, or tertiary, follicle. As the follicle enlarges further and develops a very large antrum with the oocyte attached to one side by the cumulus oophoris, it becomes the mature provulatory, or Graafian, follicle. Remember that the oocyte released during ovulation is a secondary oocyte arrested in metaphase 2 of meiosis. This is one of the most commonly tested examination points. Following ovulation, identify the sequence of postovulatory structures. A recently ruptured follicle containing a central blood clot represents the corpus hemorrhagicum. As the blood clot is replaced by luteinized cells, the structure becomes the corpus luteum. The corpus luteum is recognized by its large, pale granulosa lutein cells, smaller peripheral theca lutein cells, and abundant blood vessels. When luteal regression occurs, the lutein cells disappear and are replaced by dense collagen, forming the corpus albicans. This appears as a small eosinophilic fibrous scar within the ovarian cortex. Also recognize the features of follicular atresia. The important findings include degeneration of the oocyte, apoptosis of granulosa cells, and thickening of the follicular basement membrane to form the characteristic glassy membrane. Finally, always interpret these findings in the context of the patient's age. A reproductive age ovary typically contains follicles at different stages of development, along with corpora lutea and corpora albicantia. In contrast, a postmenopausal ovary contains very few or no developing follicles and is characterized by dense fibrous stroma, a thicker tunica albuginea, and numerous corpora albicantia. With this, we have completed the normal histology of the ovary. In this lecture, we studied the microscopic organization of the ovary, the sequential stages of follicular development, ovulation, formation of the corpus luteum and corpus albicans, follicular atresia, age-related histological changes, and the practical features used to identify these structures under the microscope. A thorough understanding of normal ovarian histology forms the foundation for recognizing the pathological changes encountered in diseases of the ovary. Thank you for watching. I will see you in the next lecture.